Hello, this is Dr. Stanley Lang, and welcome to this broadcast. This is a broadcast on the this is a broadcast on the subject of stress and heart disease. And the question is, how much do you think stress has a role to play in heart disease? And this is a continuation of a series on whole person health. It's health of body, mind, and spirit. And so the reason that I'm talking about this today is because of a patient that I saw recently that developed, unfortunately, a major cardiac event that happened after about 3 or 4 weeks of a lot of stress and maybe a couple months before that, some moderate stress. But he was very, very stressed out, and went into a cardiac event that we were able to treat. So he's surviving, but both he and his wife instinctively knew when we talked about what had happened to him that the stress that they were experiencing was playing a major role. Now, when you talk about risk of heart disease nowadays, stress isn't really mentioned as one of the major risk factors. And this is kind of interesting because in the 80s, in the 1980s, before the ability to open up the arteries with the technology that we have now and putting a stent in the arteries after the angioplasty, before that technology was available, there was a rapidly growing understanding of the role of stress, of certain types of stress, causing acceleration of heart disease, and that you could reverse that whole process once a person understood that stress was playing a role in their heart disease. Once the ability to roto-rooter out these arteries and put people on statins became available, interest in this much more labor-intensive long-term strategy for reducing heart disease kind of waned. And so it's not even listed as a major risk factor anymore in heart disease, even though it's probably the biggest risk factor. And I'm going to show you some information in just a minute to back that up. So there was a community in southern Pennsylvania called a town called Roseto that in the late 1950s, early 1960s had almost no heart disease, and they were not characterized by having healthy lifestyles. In fact, the men worked in a quarry largely, and they were exposed to lots of dust. They tended to smoke cigars continuously without any filter. They ate really high-fat, lard foods. They didn't eat the, quote, Mediterranean diet, even though they were of Italian extraction. And essentially, they did everything wrong when it comes to current recommendations for lifestyle. Well, men in that age, in that area, between ages 55 and 64, during that decade of the late 50s into the early 60s, had almost no heart attacks in a whole decade. No heart attacks. And men over 65 had a death rate that was half of the national average. And they were doing all of these things wrong. But they were doing one thing right, which was that they were living a stress-diminished or stress-free life. And researchers came in and looked at communities that were same size, men doing the same kind of work, and discovered that these communities had the death rates, the heart attack rates that were average for the United States. So what was different about Roseto? Well, one of the major differences was that this was a really tight-knit community. People pretty much lived close to each other. They knew each other. They all went to the same church. They all worked in the same place. So there wasn't a lot of people that had almost nothing and a few people that had almost everything. People were pretty much experiencing equality amongst themselves, and their self-image was good. They had a lot of community support. They all basically went to church, and so faith life was a big part of what they did. And they had help when they needed it. So they lived the essence of a tight-knit, supportive community experience, and that dramatically decreased their stress. Now, after they were fully Americanized and got into the so-called American dream, they got the same diseases and death rates that we did. Now, it wasn't related because they were eating differently. It was because that their stress levels had gone up, uh, corresponding to their new status as they became more well off, and lost the community support, that the tight-knit community that they'd had before. So you can read about this Roseto effect. There's various places on the internet that it's easy to access. But I want to encourage you that stress reduction is one of the most powerful things, if not the most powerful thing you can do to decrease heart disease. And there are many different ways that you can decrease stress: physical world, emotional world, the spiritual world. I recommend all three. And so I encourage you to look at your life and see, what can I do to decrease stress today? And moving forward, how can I decrease stress even more? So I wish you well as you maybe hopefully take a look at your life and figure out how you can decrease stress. God bless and have a great day.